In the first segment of this physician-directed informational series, the topic of universal newborn hearing screenings will be discussed. Universal newborn hearing screening programs have aided in earlier identification of hearing loss in infants. Hearing loss interferes with access to communication and language learning, which is essential to normal development. The American Speech-Language Hearing Association, otherwise known as ASHA, recommends that all newborns be screened for hearing loss. Previous strategies implemented before universal newborn hearing screening missed 50% of newborns with hearing loss. Additionally, hearing loss occurs more frequently than any other congenital condition that is screened for. Under a universal newborn hearing screening program, all babies born in the hospital should be screened before they are released, along with all babies who are born in the neonatal intensive care unit, otherwise known as the NICU, for longer than 5 days, and babies who are readmitted to the hospital within the first month of life when the conditions are associated with a potential hearing loss. Newborn hearing screening is supported by the Joint Committee on Infant Hearing, JCIH, the National Institutes of Health, NIH, and the World Health Organization, WHO.
The goal of newborn hearing screening is to identify newborns who require further evaluation. Some conditions identified at birth are more likely to cause a late onset hearing loss. For this reason, another purpose of such programs is to identify these newborns so they can continue to be monitored over time, even if they pass their screening. The role audiologists play in newborn hearing screenings include the development of programs, training of staff, implementation, and the oversight of such programs. Oftentimes, a screening compliance level of 98% is utilized.
Parents should give consent before each screening and will have the option to sign and waive the screening if this is their wish. For both ABR and OAE technology, screenings can be performed in the hospital room or in another region where it is quiet. Both OAE and ABR technology have been found to have a moderate likelihood of identifying permanent hearing loss later in life. OAE measures an infant's hearing by putting sounds in the ear canal and measuring the echo of sound that is reflected back. And ABR measures the electrical response from the auditory nerve and brainstem. An ABR screening accesses more central structures of the auditory system, which allows for a detection of neurological involvement. Some infants with mild hearing losses and those with atypical configurations of hearing loss may pass the newborn hearing screening. This is a limitation to newborn hearing screenings. For this reason, ongoing screening throughout childhood and adolescence is recommended.
For well baby screenings, both an ABR or OAE would be appropriate. For such screening, there is no interpretation made by the screener. Rather, a pass-refer outcome is utilized. The screener should not test the infant multiple times. The probability of getting an infant to pass the screening by chance increases with every additional screening that takes place. When an infant passes a hearing screening, this does not ensure they have normal hearing at all frequencies. Hearing may exist in certain frequency regions when a broad frequency stimulus is presented that is in the normal range, when other frequencies in this region may not be, and a pass is still obtained.
When a refer is obtained, a rescreening must take place. If one ear passes and the other does not, both ears must be rescreened at the next appointment. For babies in the NICU, an ABR must be utilized. Babies who do not pass in the NICU do not have a rescreening. They go directly to the audiologist. If the infant is screened with an ABR must be used for the rescreen. If an OAE is performed at the initial screening, the rescreen can either be an OAE or an ABR. JCIH recommends a timeline that includes a hearing screening to be completed no later than 1 month of age. One of the biggest challenges in diagnosing an infant with hearing loss is communicating the results to the parents. Upon a referral, the hospital personnel responsible for conveying this information to the parents should have a standard script to use when talking to families about the results. These results should be immediately available to parents. Universal newborn hearing screening was essential in the development of the early hearing detection and intervention program. EDDI provides access to services for infants and children with hearing loss.